So we are looking at the demyelinating diseases of central nervous system. All right. So just trying to describe this from what you got. Right. So demyelinating is like, let me look at it. Demyelinating is like you have a nerve, it has a myelin sheath. The myelin sheath is healthy. So if you have this same myelin sheath kind of like trying to like eat away, you understand? That's what we say it is demyelinating. Myelin sheath is going away. Okay. So they are just diseases. So here we're just trying to look at what a classification of the diseases, right? Any disease that have to do with the myelin sheath eating away is a demyelinating disease. So they are actually characterized by what? Damage to the myelin sheath. That's a protective covering that surrounds the nerve fibers in the brain and the spinal cord. So the whole disruption impairs the transmission of what? Electrical impulses, leading to a wide range of neurological symptoms. Of course, the myelin sheath is supposed to be healthy so that the communication or transfer of what impulses along the nerve is actually what according. Do you understand? So issues you can see here is what there's myelin sheath destruction. Often maybe it's what the body's immune system attacking it, maybe infections, maybe metabolic insults. Then axonal damage, maybe there's inflammation. Right? So you see this, right? A prototype of this is multiple sclerosis. All right. So common symptoms, right? So a common characteristic of the disease is that there's what destruction of the what myelin sheath. So common symptoms is visual disturbance. So if the optic nerve is involved, you have issues with seeing. Motor weakness or paralysis. Now this is because the transfer of what signals across the nerve is not smooth again. You understand? So there's sensory deficit, there's fatigue, there's cognitive changes, there's coordination issues, there's balancing issues. So if I want to diagnose these issues, if I want to diagnose these diseases, all right, first of all I'll do MRI to look at what the possible injuries. Do CSF analysis, all right. Then I also try to look at how impulses are being still transferred, okay, across that nerve. Okay, so that's what they actually call, the nerve conduction test. Then serological test. This is when I'm actually suspecting that there's an infection, so I'm actually trying to dictate the causative organism. All right, so major demyelinating diseases include things like multiple sclerosis, like I was telling you guys. So we'll just be listing them. We'll come back and discuss these diseases all over again. Then Neuromyelitis Optica Spectrum Disorder. Those ones are issues with the optic nerve. It's becoming inflamed. So typically people have issues with seeing. Right, then acute disseminated encephalomyelitis, transverse myelitis, progressive multifocal leukoencephalopathy, then central pontine myelinolysis. So all of these are actually just issues with what the myelin sheath of a nerve actually being eaten up and all of that. Okay.